My name is Dr. Richard Rosenthal. I'm the owner and founder of Nexus Pain Care. We've been in business for the last 13 years. Basically, we treat chronic conditions, primarily headache, neck pain, back pain, that won't go away.
The thing my husband likes most about his job is helping people, is having a successful injection where he has given his patient their life back. And they come back in and they're feeling great, and they don't come back for a year or 5 or 10.
Our goal is to actually improve the health of the individual so they can get back to life, so that they can do the things that they weren't able to do before they came to Nexus Pain Care.
My name is James Cloyd. I'm a licensed psychologist here in Utah. Actually, I see every new patient who comes through our clinic. They do initial physical evaluation with a provider, and then they come and do a psychological evaluation with me. And the idea behind that is because we realize that pain doesn't just affect somebody physically, it also impacts all areas of their life, including their emotions and their family life and their occupation. So we try to, we look at the whole person.
My name is Carol Haddock. I came because another doctor referred me. At that time I was in so much pain that life just wasn't even functionable.
I was having a lot of back problems, among other things, and the doctors were basically just giving up on me, and I didn't know what to do.
I had tons of pain. I was constantly on 8 or 9 pain medications. I was on those for 3 years through different doctors.
In the hospital they always say, where are you on a scale of 1 to 10? I would look at them incredulously and say, I'm so far past 10.
People have told us that we're able to succeed where other clinics have failed. They've been to several doctors, maybe 4 or 5 different doctors, and they come in here and get better.
When someone comes in and they've been down the whole road of treating their pain with pain medications, or they've had just a steroid type of injection and they've got maybe a couple of weeks of relief, it's not very encouraging. They've already been down that road before, or they've been to physical therapy initially, and that has only helped them short term. But when you tell a patient that we're able to possibly do something to get to the root of the problem and literally shut your pain off, or substantially decrease the amount of pain that you're dealing with for a year to 5 years, I mean, that's pretty amazing.
You try to treat everyone as an individual, and rather than just a one-size-fits-all pain management, we have lots of different ways of treating pain. We try to figure out what that person has tried in the past, what's been effective, what has not been effective, maybe look at some things that they haven't thought of before, and try to bring all those things together to create a treatment plan for that individual.
Because pain affects multi-systems, we have to have multiple different types of specialties to help with the pain. Most of our procedures we're able to do in our in-house, and that decreases the cost because they don't have to have the cost for the hospital, they don't have to have the cost for the anesthesiologist. So that's a real benefit to patients.
In the OR we do injections, spinal injections, we do epidural injection and facet injection, SI joint injection, those things.
Most of our procedures are very simple. The patient leaves without even so much as a Band-Aid. They're 5 to 10 minute procedures. We have all the equipment that's necessary to do the procedures that we do and to do them safely.
But really, in addition to all of that, we're trying to find other underlying causes, like what's the mechanism or the generator that's causing, say, their low back pain or their chronic neck pain. And then once we have that, then we can set them up for like a long-term treatment that we're able to do here to be able to hopefully shut their pain off, not just on a short term, but also for the long term.
My name's Shona McKay, and I'm the practice manager, and I've been working here at Nexus Pain Care for about 9 years. Our clinic was given a very prestigious award this year. After extensive evaluations, the World Institute of Pain awarded 13 pain management clinics worldwide with this award. 4 of those clinics were in the United States, and one of those 4 was our clinic, Nexus Pain Care, here in Utah.
And that award recognizes people that provide excellent patient care, but also are leaders in the field of pain, educators, that kind of thing.
Our clinic was evaluated on its multidisciplinary approach for our patient care, for our treatment of pain options, for our patient outcomes, and much more.
Nexus changed my life. That's flat out what they did.
I don't think there's anybody out there as adept. I don't think there's anybody as compassionate. And without fail, everyone I've seen in this office, they are compassionate, good people.
You're not supposed to be happy when you come in to see the doctor and his associates. But I'm always happy to come in here.
Just because of what they've done for me, you know, I have 95% of my life back.
These guys are really genuine. They really do want to help.
I would invite anyone who has concerns about their treatment of pain management or their loved ones, how they're being treated for their pain. I'd invite them to come to our clinic and sit down with one of our physicians and sit down with myself and let's kind of tease apart what's been going on in your life and let's get you back on track.
I would recommend, no matter what kind of pain you're in, to come to Nexus. I was referred here and I'm not going to go anywhere else.
I'll tell you, I would send anybody here. If my grandkids ended up where I did, I would bring them here because I have that much faith in him. He's a genuine article.
So if you're watching this video and you're suffering with pain, we would like to invite you to come in. We really do think we can help.
Our main office is located in Provo, off of University Avenue in Jamestown Square.